pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.
Hi, everyone. Welcome to your favorite program. This is the online pregnancy school, and it's always a pleasure to come your way. You know, pregnancy should be a time of joy and not anxiety or fear, as I always say. But there are so many things that can go on that would make a woman who is pregnant afraid, and even sometimes unsure of what the outcome would be. And that is why we are here. This is the online pregnancy school, and my name is Dr. Linda Vanuatu. On this program, we bring you many things that a pregnant woman and the family should know about. Let's go for a short break. Welcome back. We have had a previous discussion on hypertension in pregnancy. And it is important to talk about hypertension in pregnancy because, you know, hypertension in pregnancy and bleeding in pregnancy are two major complications that can occur in the life of a pregnant woman. And if not properly managed, unfortunately, can end in a poor pregnancy outcome, including the death of the baby, death of the mother, or death of both. But these two can be managed. Today, we're going to look at hypertension again, but this time round, how this pregnant woman can take care of herself at home with the support of her family. Let me remind you that this program is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samsara Ventures, and Erama Clinic. These have supported us over the period to bring you this program every Saturday. I hope you've been learning a lot. And please remember to visit my Facebook page at Dr. Linda Vanuatu to look at the previous episodes that we have gone through. You will learn a lot. Again, if you have any question, kindly send me a WhatsApp message on 059 242 0625. 059 242 0625. Today's conversation will be very interesting. And I'm going to do this with a sister, a friend, a colleague, a health practitioner. Her name is Madam Adobea Asiam. She's a certified registered nurse practitioner. Nurse practitioner, that means that though she is a nurse by profession, she also has the certificate to prescribe. So she can see somebody who is sick, prescribe, and make sure that this person gets well. So she's pleased to talk to us about this. She has over 10 years experience in nursing before she became a certified practitioner, and her specialty is in family practice. Adobea, you are welcome.
Yes. Thank you.
And thank you very much for accepting to join us. This is the online pregnancy school. The aim of the online pregnancy school is to educate pregnant women, non-pregnant women, husbands to be, wise to be everybody about pregnancy, because our belief is that pregnancy should be a time of joy, because you are going to bring life, so it should be a time of joy. But there are so many complications that go on that make pregnancy very difficult for some people, and that is why we are here. Today we're going to talk about hypertension in pregnancy, but focusing on the family. So we have looked at what the hospital does. We've taken a trip to the hospital. We've seen what the midwives do, what the doctors do. But we believe that the pregnant woman also has a role to play, and likewise her family. And that's why today we want to focus on hypertension in pregnancy, but with the hope. So let me ask you, is it a major problem that a lot of women have hypertension when they are pregnant?
Yes, it is. As you rightly said, if you have, some people would have hypertension and not even know that they do. And all these, they have consequences eventually on the baby and then the mother as well. So getting to know what your blood pressure values are is very important in your whole journey when you are pregnant. If it's left not treated, like you said, it can have consequences on the mother and even the baby, i.e. losing the mom or losing the baby.
So that's a big issue, and the WHO is even concerned about that we manage women who have hypertension in pregnancy very well. So now let's look at the home situation. What would you suggest that a pregnant woman does at home?
Okay. At home, if you've done your antenatal and you've been told you have blood pressure issues, I would strongly recommend, if you can, purchase a blood pressure machine and then check your blood pressure at home at least once a day. And you want to be looking for numbers, the upper number 120 to 130 over 80 to 90. It's probably in the normal range. Anything beyond that, you want to let your healthcare provider know of it. So yes, if you've been diagnosed as having blood pressure issues as a pregnant woman, I would strongly recommend, if you can, to get a blood pressure machine. If you cannot afford it, you can go to the pharmacy as well to have it checked, or even a friend can do that for you.
That's very good. And it's very easy. Now we have a lot of pharmacies around. So a pregnant woman, I'm sure if she walks into a pharmacy to say that, can you please check my blood pressure for me? I'm sure they'll be very happy to do that. So there's no point in you being there and not having your blood pressure checked regularly. So what would you recommend? That she teaches somebody at home, if she's staying with the husband or with somebody? Is it okay for this person to learn how to check the blood pressure so that that person can help for this woman to do it? And when they check it at home, what should they do? Should they document it? Should they have a place they write? What should they do?
Yes, it's okay to teach somebody at home, your husband, or even if you have children who are elderly, you can use them as well. Even your mom or your sister can do that for you. And yes, definitely keep a log of your blood pressure readings. So like I said earlier, anything between 120 and 130 for the upper number is okay. The recommendation is the normal range has to be 120 for the upper number and then 80 for the lower number. But anywhere between 120, 130 is okay for the upper number, and then 80 to 90 for the lower number is okay. If you go beyond that, like I said, you have to let a healthcare provider know. But yes, definitely keep a log. So you can get a little notebook and then you write your daily log. Anything outside of that range, you want to pay close attention to.
That's great. So would you recommend that they do it at a specific time? So for example, if I decide to do it 10 a.m. every day, should I stick to that? Or I can just do it any time of the day? What do you say?
A specific time I would recommend, if it's 10 a.m., maybe an hour before, an hour after, it's okay. Yeah. So around the same time, preferably.
Sure. So that is important. Ladies and gentlemen, we are talking about hypertension in pregnancy. In our previous discussion, we looked at what is done at the hospital. And you remember that Dr. Srofrenyo, who is an obstetrician gynecologist consultant, took us through some of the things that can happen to a pregnant woman who has high blood pressure during pregnancy. And so we saw what happens at the hospital. And today, Adobea is taking us through what we can do at home. So if we merge the two, we will be fine. It is very important because both of them have told us that if you don't take care, then the blood pressure would lead to different things, and we don't want that. We don't want that to happen. Pregnancy should be a time of joy and not anxiety or fear. Adobea, thank you very much. So I'm sure people have taken note that they will take this small book and jot the date, the time, and the reading. So when she's going to the hospital, she can carry that book and say that this is what I've also been doing at home, checking my blood pressure. And she can even carry the machine to the hospital for them to check to see that everything is working well. That's very, very important. Now, we have also heard that lifestyle plays a very important role. What do you say about that?
Yes, it definitely does. Most women sometimes will try for pregnancy even before they get pregnant. So my advice to people who fall in that category is, if you are overweight, if you are trying to get pregnant and you know that you are overweight, trying to lose weight before you get pregnant can go a long way. So you would combat some of the complications that may arise from being overweight and then having blood pressure as well. And so that would be my first advice. If you are overweight or obese and you are trying to get pregnant, my recommendation will be to try and lose some weight before the pregnancy comes, because we all know, especially back home in Ghana, mom will force you to eat for the, for the health of the baby. And by the time you realize, you keep pounding on the pounds. So, if you are already overweight and then you get pregnant and you put on more weight, it just has a lot of health consequences. So losing weight, if that is what you are trying to do, losing weight before getting pregnant would go a long way to help. Some people also get pregnant without trying. They just wake up one day and then they find out that they are pregnant. With those people, of course, if you are already obese, I don't want you to starve yourself. Or if you're already overweight, I don't want you to starve yourself either, but I want you to keep your weight in a manageable range so you don't skyrocket. When I say that, I mean you want to watch what you eat. So you want to make healthy choices. If your food prior to getting pregnant was saturated fat, foods high in cholesterol, then you want to watch it. You want to do more of whole grains. You want to do more of vegetables, more of fruits. And then try and manage the weight that way. Don't starve yourself or don't go on any weight loss, journey because of the baby, but you want to keep your range, the rate at which you are putting on weight. You want to try and curtail it into a manageable and a sustainable weight range.
Wow, thank you very much. When we come back from the break, we'd like to know some of the foods that are high in saturated fat that we should avoid. Let's go for a short break. Welcome back. So today we are talking about hypertension in pregnancy and looking at what we can do at home. It's important because hypertension in pregnancy, if not managed, can have very bad consequences, and we don't want that. My guest for today is Madam Adobea Asiam. She's a nurse practitioner, and she's helping us to understand what we can do at home. One of the key things she's told us is that if you're at home, you know that you've been told you have hypertension whilst you're pregnant, please get a book and let somebody or you yourself check your blood pressure on daily basis and jot it down. And when you go to the hospital, you can then share with your midwife or your doctor that this is what my blood pressure is looking like, and they'll be helpful. The next thing we are talking about is the lifestyle that we can go through. She says that if you are trying to be pregnant, please, and you are very big or fat, then try to lose some weight. But if you are pregnant and you are fat, don't starve yourself, saying that I'm going to lose weight, because your baby may not be able to stand that weight loss journey that you've embarked upon. So, Adobea, what are some of the foods that are very high in these fats that we should not be eating?
Okay, so over here in America, obviously you have the fast food, so the McDonald's, the fries, burgers, anything that you cook in fat, you want to basically watch it. If you would use fat, I would recommend using healthy fat, so maybe coconut oil, avocado oil, and then stay away from the vegetable oil, and the butters and the fried foods. You want to do more of baking. You want to do more of grilling, and then try and stay away from all the fatty foods, fast foods, as much as possible.
Wow. And sometimes those things are nice.
They are.
The bad ones taste good. Sometimes you just want a little bit of something. Once you are pregnant, that sometimes you feel like eating the bad things. But
Yes.
Well, ladies and gentlemen, it's all about moderation. It's all about trying as much as possible to stay healthy whilst you are pregnant. That is very, very important. We'll try to do that. Now, what are some of the other lifestyle things that we can do to help us at home?
Okay, so exercise. Unless you have complications where the doctor has told you to have maybe practice bed rest, which they would pretty much tell you to just stay in the house, make sure you rest as much as possible. If you don't have any complications like that, where you are told to practice bed rest, then you can exercise. Simply walking, you can walk around your neighborhood for like 30 minutes. That's enough. You don't have to do any strenuous exercise, because you don't want to mess up anything as far as the pregnancy goes. So just little exercises here and there, little stretches, walking around the neighborhood, like I said, for 30 minutes is enough, as when you are pregnant. It's better to do that than to just be inactive. You want to be active, you want to walk. Walking, I would recommend a lot. As a form of exercise.
Yes, thank you. Because walking is everyday thing, right? And
Yes.
Even if you don't want to go outside of your home, you can still walk inside your home. If it is the kitchen, if it is the living room, if it's the compound, whatever space is available for you, you can just walk. And 30 minutes a day is not too bad. I'm sure we can do that. So that one, should it be a continuous 30 minutes, or you can walk for 10 minutes, rest a bit, then do another 10 minutes? How can we do that?
Yes, if your strength will allow you, you can do 30 minutes and get it over and done with.
Okay.
If your strength will not allow you, do it in pieces. You can do 10 minutes here, 10 minutes there, 10 minutes there. So it all depends on how you feel that day. But keeping it consistent, keeping the consistency is the key. So you want to try and do it every day, but it really doesn't matter if you want to do it in 30 minutes or in little blocks.
Okay. That's good to know, because some people don't want to walk so fast for a long time. So you can, ladies and gentlemen, if you're at home, you are a pregnant woman, or if you're a man, your wife is pregnant, please support her tell her, I can even hold her hand. Let's do this little walk, and it will be very helpful. The fact that you are pregnant doesn't mean that you are inactive, just sitting there every day. And we have also had a session on exercises in pregnancy. So I recommend that you go back to my Facebook page at Dr. Linda Vanuatu and look for that episode, and please watch it, and you will get some of the exercises that you can do. But walking is key, and that is something that we can definitely do. Let's go for a short break. Welcome back. This is the Online Pregnancy School, and this program is proudly sponsored by Promise Ghana. We are concerned about the health and well-being of people. Vanuatu International, we are concerned about the development of individuals for them to attain the best level that they can get to. It's also sponsored by Erama Clinic. You know, it's important to mix public health and clinical care. If you are looking for a place where you can get the best of healthcare, then please locate them at Sakumono in Accra. This program is also sponsored by Samzara Ventures, manufacturers of Bubble Gold liquid soap. Still in the COVID season, you need to be washing your hands. You need to ensure that everything that you are doing is hygienic. So use Bubble Gold liquid soap and you'll be happy you did. The program is also sponsored by Reverse Tap. And Reverse Tap, they are into events. If you are having a party, a wedding, or anything that you need to serve drinks, please remember to contact them, and they will give you piece of care using this wonderful way of getting drinks served to people, where it is very hygienic and you don't have to bother at all. Today, my guest is Adobea Asiam. She is a nurse practitioner and she specialized in family practice. We are talking about hypertension in pregnancy, and this time focusing on what we can do at home. Adobea, so we are moving on. And there's something they call the DASH diet. What is that? DASH diet.
So DASH, yeah, so it's an acronym or an abbreviation for your dietary approach to stop hypertension. So the things you do, as much as watching the foods you eat in an attempt to stop you from getting high blood pressure. That's basically what it stands for. So it's a dietary approach in stopping hypertension or to stopping hypertension.
And anybody can join that or can do that. You can do it yourself, or is there something specific that they go through? Yeah.
Yes, anybody can do that. You can do that from your home. So pretty much they recommend reducing your sodium, so salt. You want to watch your salt intake. We believe that salt, has an adverse effect on hypertension, on blood pressure. So too much salt would actually make your blood pressure go up higher. So the DASH recommendation is you reduce the sodium intake. So pretty much watching how much salt you cook with, or not even adding salt onto your food is one of them. You want to read labels. Over here, a lot of people eat canned foods, fast foods. Those are all saturated with salt. So you want to watch all those things. The sodium, just read the back of the food, the label, and see how much sodium they have in there. It will be best for you to cook at home, if you can. Then you know how much salt you're actually putting in the food yourself, than to buy it, from somewhere. It's already done. They have all these added preservatives and salt. So yeah, if you can, just cook it from home.
Okay. And then if you're cooking from home, with the way we cook our foods and what we add, there are these additives, or what they call the spices. Some of them that are already prepared. That if you are adding them to your food, you have to be careful because they are also filled with salt. So pregnant women I know that when you are pregnant, it's kind of a challenging time because the bad things actually taste nicer. And maybe you are eating and you say, there's no salt in this. But for your own sake and for the sake of your baby, and especially if you have been told that your blood pressure is a bit high, you wouldn't want to be pouring salt onto your food as you eat. So please, let's take note of that. What about water? Water, should we be drinking water? Is it part of the plan that we take in water? Yeah.
Yes, we should. We should. Usually, if somebody comes into the hospital with a high sodium level, one of the things we do is to give them IV fluids. You do that to kind of dilute the sodium they have in them. So water is a good thing. You drink a lot of water, it flushes out through you peeing a lot of the toxins. It will flush out some of the sodium. Of course, you don't want to overdo it, but you want to drink enough water. You don't want to be dehydrated. You want the baby to be hydrated. You want yourself to be hydrated. So drinking enough water is also a key. Yes.
Yeah. So, sometimes people think that I have to feel thirsty before I drink water, but it will be good for you as a pregnant woman to make it a point that maybe every 15 minutes I'll take in some water, not too much that you'll be vomit or anything, but just be drinking a lot of water to keep yourself hydrated. That way, you keep yourself well, because then as you go to the bathroom to urinate, you are getting rid of anything that should not be in your system. So we recommend that you drink water, not just when you are thirsty, but even as you are around after eating, before you eat, whilst you are sitting, because we'll be sweating. We know it's warm in there, so we have to be able to do that. Okay, what about alcohol? Some women, when they are pregnant, they think that I have to take a little alcohol to be able to eat well. Can we drink when we are pregnant?
I would not recommend it at all. Alcohol and blood pressure are not friends. It has an adverse effect of your blood pressure if you already have hypertension. The other thing it does, which it's probably not a topic for this discussion, is it can actually put your baby into withdrawal. Your baby can go into withdrawal when you give birth. So that's probably another topic. But yeah, alcohol, and since the focus is on hypertension, alcohol and hypertension does not match. Not even when you are not pregnant. If you have high blood pressure, we recommend you don't drink. So it's not advisable at all in pregnancy.
Yes, and we have also done a session on alcohol use in pregnancy. So we recommend you once again that you do that. You mentioned it. It is still under pregnancy, so we can say a little bit about it. When a pregnant woman drinks, it's as if the baby is also drinking. Is that correct?
Yes, it is. Mm-hmm.
So when she delivers, then what happens? That you mentioned withdrawal.
So if it was the mom's habit, like she drank every day consistently, whatever happens to you as a mom can happen to the baby as well when you give birth to the baby. So say you drink every day, it's a habit. When you don't drink, you get the shakes, you don't feel normal, but anytime you drink, then you go back to feeling normal again. The same thing is going to happen to the baby when you give birth. When the baby doesn't have that drink, which it is used to get in whilst in your belly, it is going to withdraw. So it's gonna be jittery. It's gonna the same way you would feel, the baby would feel the same way as well.
And you don't
which
want
is not
that.
good. Yeah.
No, nobody wants that. So please, if you're a pregnant woman, it is not true that you have to drink to be able to eat. It is not true. So please stay away from alcohol if you are pregnant. Okay, Adobea, we also know that stress can be a bad thing. How about that?
It is true. Stress, research has shown that stress can actually have a negative impact on your blood pressure. Anytime you are stressed, your blood pressure goes up, your heart rate goes up. Sometimes you even feel like you have chest pain, your heart will be pumping, palpitations. So as a pregnant woman, we recommend that you try and be in a stress-free environment as much as possible. Anything that's going to give you stress, you try to stay away from that, for the ultimate health of you and then the baby.
Yes. And a lot of people worry about a lot of things. You know, there are some things that you can't do anything about. And if that is the situation, why worry? So just focus on your health, focus on the health of this beautiful baby who will be coming into the world. And as much as possible, please do not stress yourself over things that you can't handle. And for the husbands and the others who are staying in the same home with this pregnant woman, we are asking you, please support them. Some pregnant women go through so much, so much, so much. We have spoken about the mental well-being of the pregnant woman. Anything that happens to this woman happens to the baby. If she's unhappy, the baby will be born unhappy. And you'll be amazed that this can affect the rest of this child's life on earth. So we don't want that. So that is what Adobea is telling us, that please, as a pregnant woman, don't put yourself through stress. If you have any issues that are overwhelming, when you go to the antenatal, talk to the midwife about it. Talk to the doctor about it. We have mental health people who can help you. We link all these things so that we know that pregnancy should be a time of joy and not anxiety or fear. I'm talking to Adobea Asiam. She's a nurse practitioner who has graciously agreed to speak to us about hypertension in pregnancy, but from the home side. And we have gone through a lot. If you have any questions, send me a message. If you are sending the message from outside, then it is +233 59 242 0625. If you are sending it from Ghana, of course, it is 059 242 0625. Adobea, so now, what are some of the symptoms that a pregnant woman who may not know that she has hypertension during this pregnancy can experience, and for which she should rush immediately to the hospital?
Okay. Any unusual leg swelling? Leg swelling, sometimes when you dig your finger in your leg, it actually pits, so you have an indentation. That is usually, even if it's not hypertension, you want to get that checked out if it's not due to hypertension. Some of you would feel dizzy. That sometimes is coming from the blood pressure. Sometimes you would have headaches. Sometimes even nausea, vomiting, blurred vision, like you can't see well. Sometimes you can have chest pain, palpitation, your heart pounding more than usual. Those are all signs that warrant a healthcare provider's attention. So I would recommend that you go to the hospital to get checked out. It may be coming from hypertension, it may be something else, but those are definitely not things you want to be experiencing when you are pregnant. Some leg swelling, through pregnancy, it would happen, but anytime it's excessive, you put your hand in there, it indents, then it's time to let your midwife know or your doctor know for them to do some more testing and figure out what's actually going on, why your leg is swelling the way it is.
Wow, thank you very much. This is very easy to do. If you find that your feet are swollen, don't stay at home. If you wake up in the morning, you see that your face looks more puffy, don't stay at home. If your hand feels like it's heavy, or if there's any way that you think today I'm not feeling the same way, please don't stay at home. And that's why the antenatal is very, very important. My guest for today is Adobea Asiam, a nurse practitioner within the family practice. My name is Dr. Linda Vanutu, and this is the online pregnancy school. Adobea, as we bring our conversation to a close, what are some of the key points that the people out there, the pregnant woman, the husband, other people who are not even married or pregnant, should take note of, so that we can avoid the bad effects of hypertension in pregnancy?
Okay. So if you know you have high blood pressure during pregnancy or even before pregnancy, I would recommend you get a blood pressure machine. You check your blood pressure on a daily basis and keep a log of it in a little notebook. Your significant other can do it. Your husband can do it for you. Mom can do it. Your children, if they are older, can also do it for you. So that's something that I strongly recommend. If you don't have the means to get the blood pressure machine, you can always go to any pharmacy. A lot of the pharmacies now have machines that you can use. Or if you don't feel the same, like the things we talked about, waking up in the morning, your face being more puffier, feet being more puffier, chest pain, blurred vision, just go immediately to your midwife or to the hospital. Lifestyle also plays an important role if you want to manage blood pressure. So watching what you eat closely. You want to limit the salt. You want to make healthy food choices. So less of the fried stuff, less of the saturated fat, foods high in cholesterol. You want to do more of baking than frying. If you do decide to fry, as we talked about earlier, sometimes your taste buds will not allow. Then you use the healthy options, so coconut oil, avocado oil, and then you stay away from the ones with a lot of trans fat. Exercising is also a good one in managing blood pressure. You can do as little as just walking in the house, within the house environment, in the kitchen, in the hall. You can do that. You don't have to do 30 minutes at once if your strength won't allow you. You can do it in little blocks, 10 minutes here, 10 minutes there, 10 minutes there. That is only if you don't have any contraindication. If your doctor tells you you can't do any of that, please adhere to the instructions. If you have to be in bed, make sure you do that, because going outside of that advice may be detrimental to your health and to the baby. So make sure there is no contraindication in doing that. And then we talked about alcohol. You don't want to drink. That's a no-no in pregnancy, and it's a no-no. Alcohol and hypertension, they don't do well together. So you want to watch that. One thing we didn't talk about too is caffeine. Those who like coffee. If you have hypertension, that doesn't go well with caffeine either. It has a tendency to raise your blood pressure. The other thing I wanted to mention is potassium. You want to eat foods rich in potassium. So, because research has shown that potassium kind of has a way of affecting the sodium in your body. So more potassium, it does something to the body, and then it reduces the potassium overall. So you want to eat potassium-rich foods, so bananas, a lot of the potassium you can get from green leafy vegetables, kale, spinach, and stuff like that. And then eat fruits, drink lots of water. We talked about drinking water. You want to drink water. Drink water not only when you are thirsty, but give time yourself. Just drink water. Maybe every 15 minutes you take a sip. We don't want you to gulp it down to the point where you are vomiting, but at least make it a point. Make a conscious effort to take sips of water throughout the day. So yeah, those are the points that I believe we should stick to and adhere to.
Great. We have had a wonderful conversation. These are all easy things that we can do. We can do them. I'm sure we can. So please take note. And if you have any challenge, you wake up in the morning, you have any reason why you feel that there's something wrong, please go to the hospital. We have spoken about the benefits of the antenatal clinic, and they are there to support you. The midwives are there to support you. So please, don't let anything prevent you from having a good pregnancy outcome. There's no point, because the beginning of pregnancy is very challenging. So if you're able to go through the vomiting and all that, and you get to the end of your pregnancy, don't let anything prevent you from getting your baby, and you, the mother, also staying alive and healthy. Hypertension in pregnancy can be very, very challenging. And the complications, you don't want to live with them. From the top of your head to the sole of your feet, you can have challenges all through your body. And you don't want to do that. You don't want to lose your pregnancy. You don't want to lose your baby. You don't want to lose your life because of hypertension. So please, don't stay at home. If you have any reason to believe that today there's something wrong with me, or I cannot feel my baby moving well, or yesterday I did not feel this way, today I have a headache, my vision is blurred, I cannot see well, don't stay at home, please. All we want you to do is to enjoy your pregnancy whilst you have a very good outcome, that is a live baby and a live, healthy mother. That is what we want. This has been the online pregnancy school. My name is Dr. Linda Vanutu, and my guest for today was my own sister, a friend, Adobea Asiam. She's a nurse practitioner and she's with the family practice division. She's told us a lot. A lot. I'm sure if we go by what she has said, and from now we get that little book and start documenting the blood pressure, we will immediately pick it when it starts going up and go to the hospital. We are telling you all this not to scare you, but rather to make you aware that you have to be part of the care that you receive from the hospital. If you do not take part in it, it will not help us. So please take part in the care that you receive, and that will be awesome. Adobea, thank you once again very, very, very much. I know we'll have another opportunity to have another conversation on another aspect of pregnancy. Dear viewers, I hope you have enjoyed today's program, and go back to my Facebook page and the YouTube channel. You look for Dr. Linda Vanuatu and also for SHIC Ghana TV. Look for that and go through the previous sessions that we have had. Piece all of them together and you will have a wonderful time during your pregnancy. And for those who are yet to marry, it is also an opportunity for you to learn more about pregnancy so that your pregnancy will be a time of joy and not anxiety or fear. See you another day. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare.